Hey, let's talk about prostate cancer. Prostate cancer is an exemplar that falls under the concept of cellular regulation, which from A&P, hopefully you remember, cellular regulation refers to the concept that the cell is the basic structure of the human body. Cells form organs, they form organ systems and then organisms. So this would be a dysfunction of the cell in the prostate. This is a very common, you'll probably most definitely see this. It is one of the most commonly diagnosed cancers for men globally. It only affects men, right, because females don't have prostates. So it's exclusively a disease for males. The problem with prostate cancer is that it's pretty slow growing and not usually easily recognized. So it's sometimes pretty far along before it's discovered. And by then it's already metastasized to lymph nodes, bone, rectum, bladder. Some of the symptoms you'll see look just like BPH. So if somebody already has BPH, it's pretty hard to recognize that they've got prostate cancer. So risk factor, of course, would be family history. Diets high in red meat, which we love here in the U.S., high consumption of calcium, and then obesity is also a risk factor. So as you can see, these clinical manifestations are the exact same ones that you would see with BPH. So trouble urinating and a weak stream of urine. That's not usually going to alert any man to think that he has prostate cancer, which is why it is so important to stress those screenings. So those screenings are the digital rectal exam. They should be getting that annually at their primary care office, starting at age 50. If there's a strong family history, or maybe if they're African American, which is also a risk factor, then they may need to start even earlier, like age 45. The prostate-specific antigen is a blood test, so that should also start around the same time. So that would be high in the case of prostate cancer. So if they find something suspicious during that digital rectal exam, or if the PSA is really high, they'll decide to do a biopsy of that of the prostate, which would then give the definitive diagnosis of cancer once they look at those cells under the microscope. And then in that case, they're definitely going to have to check to see if it has metastasized, because oftentimes by the time it's caught, it already has. So treatment for this would include radiation. That can be external, which, think about the area that you're talking about. That's going to cause a lot of damage. Could also involve brachytherapy, which is internal radiation. So they can put radioactive pellets inside of the prostate, and then that person becomes a little bit radioactive. So we'll talk about some precautions that you would need to take if somebody is getting this brachytherapy. Cryotherapy is when liquid nitrogen is placed in the prostate to freeze it. This is not as effective, has a pretty low success rate. Ablative hormone therapy is usually only used late when it's already metastasized, and is really just for symptom management so that it slows down the growth of the tumor. Chemotherapy is pretty common, especially for advanced stages of prostate cancer. So we'll talk about those more in class. And then a radical prostatectomy is just what it sounds like. It's complete removal of the prostate. That's going to have a lot of side effects, so that's usually used as a last resort. This person's probably going to definitely have some sexual dysfunction, become infertile. And most men opt not to do that unless it's absolutely necessary. So complications, of course, from the chemotherapy, we're purposefully suppressing the immune system, so that is going to lead to a higher risk for infection and bleeding and all the other things that we talk about when we talk about chemotherapy. We also need to talk about sexual dysfunction. This is really important to everybody, right? Your sexual function. So this can lead to long-term sexual damage, especially if they get chemo, radiation directly on that area. and then if they have a prostatectomy. And then another big concern is this obstruction of urine flow. If there's a big tumor there and it's occluding the urethra, then all of that urine is going to get backed up to cause obstruction. You're going to end up getting UTIs, maybe pyelonephritis, and it's going to become a big problem pretty soon. So make sure you do your readings, and we'll get into this a little bit more when we get together in class.